How do we assess ready? So we treat the medium and the high risk, not the low. Well, we have to evaluate your medical status. What's your age, sex, pregnancy status? I mean, how many kids have you had? How far postpartum you're in? That's not on here. Your symptoms. So that goes back to that, what I just was talking about. What is your medical history? Menstrual health, bone health, dietary health. Are there signs that we can go off? Did they measure hormones, electrolyte imbalances, magnesium, calcium, sodium, all of those that help drive our nervous system? If it's really severe, they'll do heart testing and then also bone tests, and then screening you for depression, anxiety, disordered eating disorders, and then evaluate the seriousness of the condition. So what degree of abnormality of your hormone and metabolic function are we dealing with? Is your metabolic system like so set back and fatigued because of this prolonged state of disordered eating patterns or low energy availability? And then do you present with a cardiac arrhythmia, or do you have stress fractures? Those are huge. Then we evaluate what's your risk if we do put you back into participation. And what goes into that is, all right, what do you want to get back to? What's your sport? What's your fitness activity? What do you do there? Like if you're on a sports team, what's your position? If you are just a recreational athlete versus an elite athlete, or if you're a recreational athlete, how competitive are you? Are you always competing? And then last is decisions, making decisions. And this is really tricky because there's a lot of pressures on a healthcare provider. This is a healthcare provider assessment. So we decide, okay, what's the timing? What's the season? Where are you relative to other factors in your life? What kind of pressure are you putting on me? And as an active adult, like, what are you threatening me with? Like, or where are you trying to manipulate me? I get it all the time. Well, this is how I relieve stress. Mental readiness. How ready are you ready to go back or continue to participate? Are you going to abuse the privilege? What kind of external pressures am I getting elsewhere? Is there a conflict of interest in everyone that's putting pressure on you? So external pressure for you would be, your teammates or your friends, your husband, your boyfriend, your partner, whoever. And then, of course, from a healthcare provider, fear of litigation, most often from coaches and sponsors. So I see this more often than I like in moms. And I think this is part of the problem, and a lot of moms getting into these cycles of pain, or they're not seeing results. And I believe everything happens for a reason. I believe I was in this class, in this women's health physiology class, that not only gave me insight on my female athlete journey, but then also opened my eyes to pelvic health physical therapy and all of the problems that are around culturally around athletes, that are influencing these pressures that are creating a physiologic crisis in women. And I believe that we need to speak up. People like me need to speak up for moms, because this isn't just an athlete problem. So I appreciate you watching. If you want more info, you can comment me